Good morning and welcome back to GP Video Podcast by Nadia. So from today, we'll start talking about a condition that is heard these days a lot around us and which is called fatty liver. Fatty liver looks like a very general term, so I would like to tell you specifically what fatty liver means, how is it caused, what is the treatment, because this condition is nowadays very common and you must have heard this name a lot these days. I mean, I'm sure you all have heard about fatty liver. So we'll start with the definition, and I might have to make few more podcasts on it because, as you know, the topics that I cover, I can only speak about them 5 to 7 minutes and I do not do justice with them, but I make more and more video podcasts so that I can tell you more and more about them. So fatty liver is also going to be one of those topics. What is fatty liver? Fatty liver disease describes a range of conditions caused by accumulation of fat in the liver, as the name suggests. The disease affects about 10% of Australians and is the most common reason for mildly abnormal liver function tests. When you go to a doctor and get the liver function test done, they are mildly abnormal and usually the cause is fatty liver. It rarely causes pain, does not cause nausea or fatty food intolerance, but can sometimes indicate other health problems. Okay, so what causes fatty liver? Fatty liver is not caused simply by eating fatty foods. That is just a misnomer. That is just a misconception. It is associated with health problems such as, number one, obesity. About 20% of people considered obese have fatty liver disease. Number two, of course, high blood cholesterol and triglycerides. Number three, type 2 diabetes mellitus. And number four, heavy alcohol use. So basically, when you are diagnosed with fatty liver, you would have one of these four conditions most commonly. Number one is overall obesity. Okay, so all these conditions can be there in conjunction or can be there alone. So the four conditions that we spoke about, number one was obesity, number two is high cholesterol and triglycerides, number three, type 2 diabetes mellitus, and number four, heavy alcohol use. So these four conditions can be there, either one of them, two of them, three of them, or four of them. All four can be there, only one can be there, only two can be there, or three can be there. So this could be multifactorial or it could be just one factor causing fatty liver. Okay, so whenever we talk about fatty liver, please remind yourself that there could be, most commonly, there are other conditions as well that can cause fatty liver, but the most common conditions are obesity, being overall obese, high cholesterol and triglycerides, type 2 diabetes mellitus, and heavy alcohol use. Either any one of them, or two of them, or three of them, or all four of them. They can be there and then they could be causing fatty liver. Less common causes include underactive thyroid or hypothyroidism, certain medications, polycystic ovarian syndrome, polycystic ovaries, and complications late in pregnancy. Some of these conditions are associated with resistance to insulin, a hormone that body produces to utilize sugar. If you are insulin resistant, your body is not as sensitive as it should be to insulin, and so blood sugar levels can exceed the normal range. By losing weight and increasing physical activity, you can reduce insulin resistance. So this condition is also associated with insulin resistance, because when there is too much sugar, then this condition of fatty liver can also be associated with it. So, and as we have already said, that type 2 diabetes mellitus is associated with fatty liver, is one of the most common causes of fatty liver. So insulin resistance is the mechanism of type 2 diabetes mellitus anyways. So insulin resistant people, obese people, type 2 diabetic people, heavy alcohol use, and high blood cholesterol and triglycerides, hypothyroidism, polycystic ovaries, and some complications late in pregnancy can cause fatty liver. Now, what is non-alcoholic fatty liver disease? What is non-alcoholic steatohepatitis? And what is the treatment for fatty liver? We'll talk about it soon. Thank you so much.